Hi, welcome to our first series of the benefits of exercise. My name is Debbie Scotton. I'm a nurse and exercise physiologist from the UNC Healthcare System at Chatham Hospital. First thing I want to introduce to you is the difference between physical activity and exercise. They're not the same. Physical activity is completing work or moving around, and it is not structured. You may do it a few minutes, stop and rest, or you may go at it at a slower pace. Usually, it is not considered aerobic. There are some exceptions, like push mowing the yard. Exercise is formal, structured, planned activity specifically tailored to elicit a training effect. All exercise is not the same. There is the principle of specificity of training, which simply means that the exercise is specifically going to target one outcome that you would like to have happen. For instance, if you want to make your arms stronger, you wouldn't do sit-ups. You need to perform the right type of exercise at the right intensity to get the right result. Your skeletal muscles need to be overloaded in order to get stronger. Your heart muscle needs to be overloaded as well, and you overload that by creating a circulatory overload that occurs only with aerobic exercise. Skeletal muscles can be overloaded with resistance training, such as lifting a hand weight. What is aerobic exercise? Aerobic means with oxygen. Any movement that is continuous for 20 to 30 minutes with no rest is considered aerobic. The body has to take oxygen out of the air and convert it to energy at the cellular level in the muscles. The more you do, the more oxygen your body needs. That is why it's called aerobic. Examples are riding a bike, chair aerobics, walking, jogging, dancing, and swimming. The key word is continuous. You do not stop completely and take a break. Initially, you may need rest intervals as you start your program, but you will be able to build up to continuous exercise. So don't worry if you're not able to do 30 minutes on day one. The goals of our aerobic training are to establish an aerobic base of 30 minutes of continuous exercise. Goal 2 is increase your time and target. The heart rate is in a target heart rate range for the entire 30 minutes. Your specific heart rate range will be determined by your provider or your cardiac or pulmonary rehab team. We will measure your functional capacity, meaning that your heart's ability to exercise at higher intensities will increase. Functional capacity can be measured by the amount of feet you can walk in 6 minutes, or simply by looking at the workloads you're able to do on a piece of exercise equipment. We can actually predict your life expectancy just based on how much exercise you can do. The higher your workloads, the less likely you are to die of a heart attack. Some of the most important benefits of aerobic exercise is developing coronary collateral circulation. Collateral circulation is the process in which the system of small, normally closed arteries opens up and starts to carry blood to the parts of the heart where a coronary artery is blocked. This can also happen in blood flow to the brain, to the kidneys, and to your feet. As you'll see in our example of the heart model here, you can see a lot more arteries feeding the heart muscle on the right-hand side. Collateral circulation can also occur in legs and feet. Again, it can happen to the kidneys and also to your brain. This is a very good diagram showing that where there's a blockage in your main artery, you can build collaterals around it. It is simply bypassing or creating a bypass around your artery, and you can do it without surgery. Collateral circulation only happens when you have developed both the aerobic base and your time and target. Respiratory benefits means that exercise improves your lung capacity. Exercise increases the blood flow to your lungs, allowing the lungs to deliver more oxygen into the bloodstream. Metabolic benefits. Regular exercise greatly improves your overall metabolic function, which helps in your general health. Exercise increases your muscles' ability to burn fat more efficiently. It also mobilizes fatty acids in your bloodstream from your fat deposits. These last two effects of regular exercise tune your metabolism into more of a fat-burning machine. Exercise can reduce your triglycerides because it's reducing the fat levels in your blood. Exercise increases your good cholesterol, and it also reduces insulin resistance. Regular exercise helps to prevent and control type 2 diabetes in patients that are at risk for the disease. Many diabetic patients can actually decrease the dose of medicine once they start exercising on a regular basis. There are musculoskeletal benefits. It increases the size and strength of your muscles, increases the strength of your ligaments and tendons. It also increases the number and density of capillaries that supply blood to your skeletal muscles. Exercise increases the number and the size of your mitochondria in your muscle cells, which allow your muscles to burn more energy. Exercise increases your stamina, your fitness, and it can also help ward off viral illnesses. It boosts your mood and helps you stay active and independent. Most people that exercise actually are able to live longer. Forms of aerobic exercise include aerobic dance, bicycle, aerobic exercise in the water or water aerobics, and exercise equipment. How to get started? Well, before you start your aerobic exercise, you need to do a 5-minute to 10-minute warm-up. You'll start with light to moderate pace and slowly increase to a normal pace. You want to gradually redistribute the blood flow that's usually in the core of your body to the working muscles. This effort decreases the likelihood that you will have chest pain during your workout because it gradually overloads your heart. A cool down is just as important. Once you've got your heart pumping hard and your skeletal muscles are helping with the pumping and movement of blood, if you stop abruptly, your blood can pool in your extremities. You could get lightheaded or dizzy, so you always want to slow down slowly. The talk test is a simple way to track your intensity. You should be somewhat short of breath when you exercise. If you're not a little short of breath, your intensity is probably too light to make the aerobic benefits that you want. On the other hand, if you're gasping for breath in between each word, you're exercising at an intensity that is unsafe for you. Rating of perceived exertion is a scale used for you to decide how hard your body's working to the exertion. It goes from 1 to 10. If you're in the 1 to 3 range, you're probably exercising too light to have any benefit. If you're in the 7 to 10, you may be putting yourself at risk for a cardiac event. So there's a fine line between the two. You want to stay between the 4 and the 7 during your aerobic exercise. Target heart rate is a training zone in which is the range that defines the upper and lower limits of your training intensity. For healthy individuals that do not take medication for their heart or blood pressure, it is calculated on an age-related predicted maximum heart rate, and a special equation is called heart rate reserve. This method can be used for cardiac patients and lung patients. However, it is only under the direction of a healthcare provider. For cardiac patients that are on the medications such as beta blockers, the gold standard is for you to have a treadmill stress test or a 6-minute walk test. Your healthcare provider will be able to monitor your blood pressure, heart rate, and oxygen level while you exert yourself. Based on the information, they can derive a safe prescribed range for you. If an unsupervised or if a supervised test is contraindicated or unavailable, we can use the American College of Sports Medicine's recommendation of using resting heart rate plus 20 for the low range and resting heart rate plus 30 for the high range. Resting heart rate, for example, if your resting heart rate is 60, your low range is going to be 60 plus 20 equals 80. The high range would be 60 plus 30 equals 90. During exercise, the goal is for you to have your heart rate stay between 80 and 90 for the whole 20 to 30 minutes. Again, this is just an example, and your heart rate range may be different. Always talk to your provider regarding a safe heart rate range for you. This concludes the aerobic benefit section of this series. Thank you for your time.